continuing. All right, continuing immune deficiency syndromes. Once again, I put this completely online. We won't do this in class at all. This is the second half. And the reason why it's not very interactive, it's a pretty straightforward lecture, so I don't think we really need to meet. But as I'm going through the second part, of course, if you have any questions, feel free to shoot me an email. I'm on my emails every Sunday through Thursday evening, give or take. All right, and then on and off throughout the weekends. So moving on with immune deficiency, we're going to move into specific immune deficiency syndromes. And of course, the first one that comes to mind is AIDS, that we will go into briefly, and I have a nice little video for you. And then some other immune deficiency syndromes as well. Okay, so there are primary and secondary immune deficiencies. Excuse me. So primary means it's the disease process itself. And I'm actually, once again, there's not a lot of interaction. So I'm going to zoom in on the screen. I'm sorry, it's a little bit of a dry lecture, but watch 10 or 15 minutes, get up, take a break, finish it up, okay, in chunks and pieces, because I know this one's a little bit dry. You probably think a lot of it's dry. I think this one's really dry. So let's move in to the screen. Okay, so primary and secondary immune deficiencies. And once again, because a lot of this is what you can read, I'll sort of go over the general gist, and then you could read through a lot of the specifics. So primary means the disease itself. So this is going to be an actual disease process that someone will have, which will create a primary deficiency in their immune system. So you can see there's B cell problems, there are T cell problems, and then there's a combination of B and T cell problems. That's a big one, right? At the bottom of that first section, the severe combined immunodeficiency. So that's going to be a T cell and B cell stem disorder where they can't create either. So that's going to be a huge deficiency in their immune system. And children, unfortunately, usually will pass away from that. B cell deficiency, okay, Bruton's A gamma globulinemia is when they cannot form antibodies, okay? And T cell deficiencies, they'll be in examples to DeJour syndrome when they can't form T cells. They're actually missing that thymus on the posterior aspect of the sternum, okay? Secondary are going to be due to another cause. Okay, you can see AIDS, age is what I meant to say. Stress, yes, stress will actually cause immune deficiencies. It decreases our ability to produce those interleukins, which will help with immunity and also fever production. That's why you tend to get more sick when you're stressed, okay? AIDS, I want you to pause the tape and load this video into your browser. This is a great little overview about AIDS, okay? The primary thing with AIDS is its communicability, which we'll talk about, and the fact that HIV, which is the virus that actually transmits from person to person, which will eventually cause AIDS, HIV will destroy our helper T cells. And we just learned that helper T cells help to signal the rest of the immune system to kick into play, okay? So let's get into that. So go ahead and watch that video and then we'll go through it. So epidemiology, we all know, is the study of disease processes within a group, right? If you got that book that I recommended, The Medical Detective, I can't think of the author's name off the top of my head, but he studied epidemiology. Well, he didn't study it. He actually wrote about people who studied epidemiology. So there would be an outbreak of a disease process somewhere, and epidemiologists would go there to see why it started in that area. Okay, so epidemiology is why did this start? How does it spread? What populations is it going to be in? Okay, so HIV, and there are two strains of HIV that we'll get into, or two groupings, I should say, okay, of HIV. They actually came from, one came from a chimpanzee, one came from a monkey. Okay, we'll talk about that in a little bit. If HIV progresses to a point where it really compromises a person's health, there's a fine line we'll talk about in a little bit. HIV can cause AIDS, okay? And when you move into AIDS, you will have what are called opportunist infections, infections that people who are healthy can usually fight off, okay? The usual time frame that happens is approximately 10 years. There are many different strains of HIV, excuse me, that can cause more aggressive forms and more benign forms, I'm assuming from all the different strains, but the average would be 10 years. And it's called a retrovirus. And I believe we get into it in the notes in a little bit. But it's a retrovirus because after the virus is injected into a cell, the RNA in that cell will actually talk to its DNA, okay? And it'll cause a change in the DNA from the RNA, which is not the usual way that substances are transferred. Usually DNA talks to RNA, and RNA helps to make proteins in a cell. But in this case, RNA is actually going back and changing the genome or the genetic material in DNA. And it affects it to the point where eventually it can kill it, okay? So there are some medications that are called antiretroviral treatments. So a retrovirus, you know, retro's going backwards. Oops, sorry about that little screen in the bottom right-hand corner. Retrovirus is going to go backwards in the opposite direction of usual events, okay? So there are antiretroviral treatments which have been effective, okay? Theoretical sources of HIV, you could read through that retrovirus on your own. I went through that. Okay, theoretical sources, there's HIV-1, which is the one that we deal with in this country, and theoretically that came from a chimpanzee, okay, who had simian immunodeficiency virus, okay, and eventually it transferred through blood contact. You know, I don't know if people ate the meat of a chimpanzee and didn't cook it well enough. I'm not sure really, honestly, that transmission, but HIV-1 is from a chimpanzee, which eventually transferred into the human populace. HIV-2 is not seen in this country yet, maybe a few cases, but HIV-1 is going to be the predominant one that we'll be talking about, okay? In HIV transmission, I think most of us are familiar with, you know, via blood, sexual secretions, and breast milk. It's really attracted to those helper cells, those T helper cells, okay? Now, on those T helper cells, if you could imagine what a cell looks like, you've got the nucleus in the center, you've got the plasma membrane, you've got the cytoplasm around the nucleus. On the T helper cells are what are called CD4 receptors. They're proteins on the surface of those helper cells, and they're called CD4 receptors. That's why you may hear of those helper cells being called as CD4 cells, okay? So the virus will attach itself to the surface of helper cells. I mean, it could do it with any cells, but the cells that are most damaged are these helper cells. And the cells that the HIV virus is most attracted to are these helper cells. So the virus will enter the cell, okay, and it'll affect the RNA. The RNA will undergo what's called a reverse transcriptase, which will convert RNA into DNA, affecting the genes in that cell, which is not the normal flow of events, okay? Can control also the production of virus particles from the DNA, okay? And then we talked about those helper cells. When they're affected, they'll really lower the immunity in our system because they are the main signaler to our immune system to trigger an immune response. Now, just to sort of mention, this is on the video, that even though we create antibodies to HIV, those antibodies are not effective, okay? Those antibodies are not effective, and we aren't sure why. And that's kind of the whole gist of what goes wrong with it. So pathogenesis, okay, may take months to years before a patient shows signs of AIDS, okay? And in the acute phase, HIV infection can resemble just the flu. So people may not think that they've been infected. Now, seroconversion is when the HIV proteins will actually create antibodies, okay? And even though those antibodies cannot fight off the virus, they still are detected in the blood by the ELISA test, okay? Which the ELISA test, keep in mind, can test for other disease processes as well, okay? But that would be one of the first signs. Positive signs would be a positive ELISA test. Now, if that is positive, then they move on to, and if it's positive twice, I believe, they'll move on to a Western blot test to confirm the presence of HIV particles or proteins, okay? There can be chronic phase where they don't start to show signs and symptoms of AIDS, but they may have swollen lymph nodes, okay? Swollen tender lymph nodes, lymphadenopathy. That's kind of a generalized term for disease process in the lymph nodes, but really what people infer it is swollen, painful lymph nodes, okay? Now, if that patient moves into what's called the crisis point, and the crisis point is when within 1 cubic millimeter, or I'm sorry, 200 cubic millimeters of blood, the T4 cell count, you know, so somebody would get a little sample of blood and actually count the T4 cells. I'm sure it's automated, but, you know, just giving you a visual. If it goes below 200 cubic millimeters, then they're moving into the crisis point, and they'll start to get more of those opportunistic infections, those weird pneumonias. You know, well, we're going to go into that, cancers, things like that. Okay, so signs and symptoms. You could kind of read through this on your own rather than me reading it to you. But these are disease processes that people can normally fight off. Of course, herpes, you know, is viral, and if somebody has it, they will have it forever. But somebody with AIDS would have more predominant outbreaks, okay, of all of these disease processes, okay. Medicinal treatment. So reverse transcriptase inhibitors is going to prevent that virus from affecting the DNA. Okay, it's going to stop RNA from talking to DNA, changing the genetics of that DNA and preventing that DNA from creating more viruses. Now, there's also HIV-specific protease inhibitors. That's going to prevent the virus from the virus particles that infected the DNA from creating more active viruses. Okay, so it's kind of a double whammy. Stops the RNA from talking to DNA, and it'll prevent DNA from creating more active viruses. And I think this is pretty successful at this point. Okay, AIDS can cause all sorts of nervous problems. We're not quite sure why, really. It can cause an aseptic, which means without an infectious agent other than the HIV, obviously, an aseptic meningitis, and encephalopathies, excuse me, which are various and sundry diseases of the brain, okay? Dementia, you know, like a brain fog, almost like a fibromyalgia seizure, okay? So that's a more generalized term of things that can happen with that. HIV infection, of course, we know bloodborne is the most infectious, so needle users. The reason that it tends to spread, you know, I've heard stories about third world countries where women get raped often, and it could be transmitted that way, and then it's a sign of, I'm sure you've probably gone over this when you've gone over, you know, talking about different backgrounds, you know, people's different backgrounds. And then it, of course, having HIV is something they want people to know, so the women who were raped will have their children and then breastfeed their babies and transmit it to their babies, okay? Contaminated blood to healthcare workers. You know, I was interested. Your book said that a needle prick only has a 0.2% risk of infection. So I don't know if that's a common number or if it's higher or lower in other places. But of course, you know, there's something to be careful of. Other autoimmune diseases. Now, while I'm thinking of it, I've uploaded, I think, 3 videos for you to watch. All of the test questions, once again, will come from the notes. The videos are just a supplement, okay? Every test question that you will get will be from your notes, okay? So other autoimmune diseases. So SLE, systemic lupus erythematosus, sorry. So somebody with this can have what's called a positive ANA, or positive anti-nuclear antibodies. And they have a dysfunction in their body where their body is attacking the nucleus of their cells, okay? So can be present in other diseases. But in this disease, it has to have 4 of those 11 criteria. And one of the real predominant one, lupus, if you remember your Latin, refers to wolf, okay? There's this wolf-like presentation of a rash on the face. I have a picture of it for you. Okay, and you can read through the rest of those disease processes on your own. They have to have 4 of those. Okay, they have to have 4 of those. They form complexes, these autoantibodies with different tissues. So they'll actually form antibody antigen complexes that will attack the white blood cells, okay? Signs and symptoms, see above, okay? And it remits and it flares up. Drug-induced SLE, okay, you could once again, I didn't do the drugs, but this was in your book, so I listed them off for you. Remits after drugs are stopped. Boy, it's a little scary, right? Okay, and you could see, here's that wolf-like rash, okay, on the face. Here's a discoid rash. They can actually get a little deposition of calcium into rashes on the superficial aspect of the skin or the epidermis. And oral ulcers, excuse me. Okay, so scleroderma is another disease process that can have a positive, what's called positive anti-nuclear antibody. Okay, so it causes stimulation of these autoantibodies that can really affect, and if you see somebody or know somebody who has this, it's very obvious. Their skin gets very shiny and almost tight, and it really shows predominantly in their fingers. Their fingers look like they almost have a really tight pair of latex gloves on. The skin gets tight and they can't bend their fingers really well, okay? So it can affect the skin. Oh, and their face gets very tight as well. And the corner of the mouth almost get pulled back so their lips look like they're tightened up. And I do have a picture or two for you. So anyway, it affects those collagen fibers in the dermis of the skin and also can affect vascularity, which can decrease blood flow to skin. It can cause scar tissue, okay, predominantly in females. It can affect the skin, GI tract, heart, blood, kidneys, lung, and musculoskeletal system. I once again loaded a video for you with this, which is very, helps with a lot of different pictures for you to see what it looks like, okay? And here it is. So scleroderma presentation, polymyositis and dermatomyositis, okay? This happens quite often with other autoimmune diseases, okay? It may start as a virus or a viral presentation, and then they have a breakdown of their muscles, and they actually can have creatine kinase show up in their blood, and they will have positive ANA as well. One of the primary signs, I've actually, believe it or not, had a patient or two who've had this. Is difficulty raising their arms above their head. They have shoulder pain. They're like, it's really weird. They really can't. And I mean, they can only flex their arms forward, say 20, 30 degrees. Okay. But that can happen, you know, their shoulders can get locked up. But if somebody has bilateral presentation of shoulders being locked up, that's something you might want to screen. You might want to send them for a blood test for this. Okay. Sjogren's syndrome. I have a nice video for this for you, okay? There's a primary and a secondary. Primary, they have dry eyes and dry mouth, also some connective tissue issues. Secondary is going to be affiliated with other diseases such as RA. I think this happens more than you would think. There's affiliation between the two. Okay, so nice video for you to watch on there. Now, I believe I may have skipped over one little part. Okay, so I want to back up to hypersensitivity reactions. I apologize for that. These are just 4 little slides. Okay, these are 4 little slides that are back in your notes. I skipped over these. I was thinking about it as I was going through. You know, remember when your immune system is functioning, and it is functioning all the time. There are constantly this collaboration between our immune responses against antigens that enter our body. Now, there are times where our immune system goes above and beyond what it should, and those would be called hypersensitivity reactions. There are 4 levels of them. I think moving into the next slide, it gets a little confusing about which is what. So I don't want to say I don't care, because I care, but I don't really care if you understand which is affiliated with what. I want you to understand the concepts of what happens with these hypersensitivity reactions. For example, on type 1, this is called anaphylaxis. This will be when those mast cells will release histamine, causing blood vessels to be more permeable. So we can have an outflux of white blood cells to that area. Now keep in mind, when we make those blood vessels more permeable, not only do white blood cells leave, but we also have more fluid leave. This can happen in the nose, it can happen in the bronchi, it can happen also in the gastric glands. So it can happen in the epidermis. So if it happens in the epidermis, we can get hives. We can get those little pinpoint, they're not pinpoint, they're a little bigger than that, raised areas of hives. Rhinitis, or we get more fluid coming out of the nose, right? Conjunctivitis, where we get watery eyes. So it's all because of that permeability of blood vessels from the mast cells. So an antihistamine will prevent it does prevent them, from releasing histamine, so we don't get watery eyes and watery nose. Helps us when we have those allergic reactions, okay? So an immediate hypersensitivity, type 1, is going to be basically an allergic reaction, okay? Epinephrine and steroids can also block this. This is where you get your allergy shots, where you get a little bit of that antigen and you build up immunoglobulins or gamma globulins, okay, in response to that, to try to make your body more efficient at fighting off those antigens. And of course, this will be all our triggers, hay fevers. I'm immune to mold, or allergic to mold, wish I was immune to it. Those kind of triggers will cause this type of hypersensitivity reaction. Now, anaphylaxis, I have to turn on my mouth today, I'm sorry, I don't have enough coffee. Anaphylaxis is the generalized term. Anaphylactic shock is when it's gone totally awry. This is when there'll be a systemic response to some sort of antigen. Your peanuts. I was just talking to somebody whose son's allergic to everything. Peanuts, wheat, crazy immune responses to, like, he can eat vegetables and meat, pretty much. So he's allergic to bananas. He has an immune response to everything. But this isn't localized, okay? This is systemic. This is going to be a bad thing, because when you release histamine throughout the whole body in those subcutaneous tissues, you're going to open up all those blood vessels throughout the whole body. You're going to have white blood cells leave. You're also going to have fluid leave. We don't have a balance of fluid inside the vascular system and outside it now. All the fluid's going outside of the vascular system, causing anaphylactic shock, okay? So if you don't have enough blood in your cardiovascular system, you're not going to have enough blood getting back to the heart. It can increase heart rate. You don't have enough cardiac output to keep organs perfused, okay? So this is a bad, bad thing. Excuse me. Type 2, antibody-dependent cytotoxicity. So antibodies in our body are created that attack our own cells, okay? So these are antibodies that will attack our own cells. So graft and transfusion rejection will fall under this. Erythroblastosis fetalis, I believe we talked about that. When a Rh-negative mother has an Rh-positive baby, and the baby's blood gets into her system, she will create antibodies against an Rh-positive baby. Okay. Myasthenia gravis attacks the receptors for what's called acetylcholine on muscle receptors. And Graves' disease will attack the thyroid, causing hyperthyroidism, causing that thyroid to kick into gear. Okay, so all of these are antibodies that attack our own tissue. So immune complex. So now this is when we have a huge onslaught of antigens come in and antibodies attached to them. They can actually form these packages of complexes, of antibody antigen complexes that can actually deposit into tissues. They can deposit into vascularity. They can destroy the inner lining or the endothelium of blood vessels. Okay, so this is when a huge amount of antigen is given to somebody and they form an immune complex. Serum sickness, when you don't have the right match. Okay, blood match. Glomerular, I cannot talk today. I swear I can say all these things. Glomerulonephritis. Okay, so if somebody has a lot of strep infections as a child, they can actually get deposition of this around the glomeruli in the kidneys, which I have a picture of this in one of the lectures. They can actually get a very lumpy, bumpy kidney, okay, because there's scar tissue in there. And this can deposit onto heart valves as seen after scarlet fever. This actually happened to my mom, and not divulging patient information because she's never been a patient of mine. So my mom had scarlet fever as a child, and she has mitral valve prolapse as a sequelae to that. I say sequelae, but I can't say words today. Okay, so type 4 is cell-mediated delayed type hypersensitivity. So an antigen will be presented, those T cells will attack it, but it's a delayed response of 48 to 72 hours. This is seen with tuberculosis. Okay, this is seen with tuberculosis. So it's delayed because it's 48 to 72 hours after. Okay, so all of these hypersensitivities, I'm not going to ask you, type 4, what is that? Is that autobody, whatever. I want you to understand the concepts. Okay, the concepts that cell-mediated response for hypersensitivity is when we're going to have an onset of those T cells, and they will be in a delayed response of 48 to 72 hours. Okay, so those are the general concepts. All right, I want to thank you guys a lot. I kind of buzzed through some of that because I feel like it's stuff you could read through on your own. And if you, of course, have any questions about any of it, let me know. I will put together a 10-point quiz that'll be right from the notes for this. And let me know if you have any questions. Thank you so much.